Bismillahirrahmanirrahim. Quote of the day: develop success from failure. Discouragement and failure are two of the surest stepping stone to success. Step 2. I am Dr. Hussain Mahmood. Today I am presenting on steps to design and conduct research under kind supervision of my professor Dr. Saira Afzal. Learning outline. Today we learn about thinking about research topic, research question, literature search, literature review, formulating research question and objective, matching the research design to research objectives, defining the clarifying the research variables and analysis plan, drawing the sample, developing the tools and defining the method of data collection, monitoring and carrying out the research, preparing the data for analysis, writing the research report in the form of original article and thesis. This is the research process, different steps of research process. First step is literature review. Literature review defines search problem, and then review concepts and theories, review previous research findings, formulate hypothesis, then design research, then collect data. And next step is analyze data, and next step is interpret and report. Steps in research process is selection of topic, review of literature, formulation of hypothesis, aims and objectives, material and method, observations and results. Selecting a research topic. Criteria for selecting a research topic is refined criteria. Refined criteria is according to R is relevance, E is ethical consideration, F is feasibility, I is interesting, N is novelty, and E is evaluation and effectiveness. First step is relevance. How big is the problem? How important is to look for relevant solution to it? Our solution to it is available. If so, how effective have they been proved? Is the problem important in our local setup? Ethical consideration. Culture sensitivity must be given careful consideration. Informed consent should be ensured. Will the treatment be given to individual identified during the study who require treatment? Feasibility. Consider the resources that are required to carry out the project. Accessibility. Research a topic that has the interest and support of the authorities. Cost effectiveness, whether the resources of time, money, manpower that are being invested in the study are worthwhile. Interesting, the research topic should be interesting to researchers, wider audience and experts. The benefit and outcome utilization for the use of evidence-based practice. Novelty. In case of topic has been researched, how is your angle new? This should be addressed as a rationale of the study qualifying the so what answer. It should substantially increase the knowledge and should provide direction to policy formulation. Evaluation. Consider the evaluation of research project on similar topic to find the strength, opportunities, threats, and weakness. The rating scale is 1 is low, 2 is medium, and 3 is high. Total score out of 18. Potential research questions arise from day-to-day clinical practice. Research begins with a problem. This problem needs not to be earth-shaking. Identify this problem can be the hardest part of the research. In general, good research product should address an important question, advance knowledge. Source of research problem is observations, literature reviews, professional conferences, and expert opinion. Literature review. This step is an essential preliminary task to find out about the available body of knowledge in your interest area. In addition, the literature review is an integral part of the entire research process and make a valuable contribution to every operational step. Reviewing literature can be time consuming, doubting, frustrating, but also rewarding. Literature review functions. The functions includes to keep up with latest development in your field, to understand your topic in context of what is already known, to document important facts and ideas you wish to research on light of previous work done on it, and to avoid rediscovering the truth. This helps to bringing clarity and focus the research problem, improving the study methodology. Above all, it broadens the investigator knowledge. Such strategies on internet. Summarize your topic in one or two sentences. Identify the unique idea or concept associated with your topic. Choose appropriate keyword for each concept. Establish the relationship between each keyword and concept. Choose a bibliographic database. Online medical database. Actually, there are many online medical databases. Medline, Ovid, Google Scholar, MedConsult, Hinar, PubMed, and many others. For an academic purpose, you should use book and article as well as websites that collect important information about your topic. During the literature review, the investigator can note the detailed description of methodologies and instruments used in previous research. In addition, such detailed descriptions are the best way to determine possible approaches appropriate to their needs, such as sampling technique, interviewing, data collection method, and interventions. Formulating a research objective. A question well asked is a question half answered. The way the question is stated shows what data will be necessary to answer it and probably suggest how, from where, or from whom the data will be obtained. Objectives are defined as are an intent communicated by a statement describing the plan of the researchers in clear, measurable terms. These are the steps to formulate research objective. The first step is contextualize challenges, then go to develop a proposal, and then plan to conduct project. In fourth step, analyze present data. In fifth step, disseminate research finding. And in the last step, monitor and evaluate the project. Importance of research objectives. The importance of research objective includes brings focus to the study, avoid collection of unnecessary data, determine an appropriate study design, helps determine analysis plan. The objective should be SMART. The criteria for the objective should be SMART criteria. According to S is specific, M is measurable, A is achievable, R is reproducible, T is time bounded. The examples of the objectives are to determine the frequency of anemia in pregnancy women visiting tertiary care facilities of Punjab. To compare the effectiveness of dressing A with dressing B in patient presenting with infected wound of the foot. Now come to operational definition. Define each technical term as it is used in relation to your research product. This helps remove significant ambiguity from the research itself by ensuring that the viewer, while they may not agree with your definition, at least know what you are talking about. Thus, operational definition is the definition of the exposure and outcome variable of interest in context to objective of a particular study and their means of measurement determined. determination. For example, anemia, low birth weight, wound healing. Data collection method and sampling technique. Data collection utilize diverse methods, surveys, interviews, focus group, observation, and secondary data. Data collection instrument develop reliable, valid questionnaire and interview guide for accurate data collection. Sampling. Choose between probability and non-probability sampling, emphasizing careful participant selection. Sample size. Employ power analysis and formulas like Cochrane to ensure sufficient sample size. Cultural sensitivity. Adopt data collection method to respect of Pakistani values, norms, and cultural context. Data analysis and interpretation. Data analysis should be software used. SPSS or Stata are common statistical software packages that are used for data analysis. Descriptive statistics. Descriptive statistics summarize data with measures like means, percentage, and frequency. Inferential statistics test hypotheses and draw conclusion about the population from the sample. Presenting data. The data should be presenting in tables, graphs, and charts, visually communicative findings effectively. Interpretation. Results relate results to the research question and objective for a meaningful conclusion. Writing a research report. Original article format. This is the format for writing an original article research. First of all, title page. Title page includes the title of the research, the author name, and affiliations. Then keywords, 3 to 6 terms that accurately describe the study topic and content, aiding in research categorization. And then methods describe the research design, sample selection, data collection, technique, analysis method used in this study. Then abstract. Abstract is concise summary of covering background research, objective, method use, key results, and major conclusions. Keywords include 3 to 6 terms that accurately describe the study topic and content, aiding in research and categorization. And then fourth step is introduction. Introduction provides context, outline existing knowledge, identifies research gap, and clearly states that the study objectives. In fifth step is methods. In method section, describe the research design, sample selection, data collection technique, and analysis method used in the study. In the results section, presents the study findings using tables and figures to illustrate data and facilitate comprehension. In discussion section, interpret the result, compares them to existing knowledge, acknowledges limitations, and discuss the study complications. In eighth step is conclusion, summarize the key takeaway of the research, highlighting its significance and potential impact on the field. The research should be reference. The end step is reference. List all cited sources in consistent format. For example, Vancouver style, allowing reader to verify information and explore further. The last step is acknowledgement and ethical statement. Acknowledgement, funding source, research approval, potential conflict of interest, and ethical consideration is also mentioned in the original article. This is the quality assurance and monitoring chart. Planning and design should be in month 1 to 4. In month 5 to 7, data collection. Then go to month 8 to 13, data analysis. And then month 14 to 18, dissemination or interpretation. This is Gantt chart for research schedule. Uh, the first task is planning and design. In planning and design, recruit research team, train researchers, select sites, develop questionnaire or test, survey and interviews, and IRB approval. And the next step is data collection. Data collection of facility surveys, past patient records, provide surveys, and patient surveys. The next step is data analysis. Data analysis includes quantitative analysis, translate and transcribe, and qualitative analysis. The last step is monitoring and dissemination. Monitoring dissemination include policy briefs, policy workshops, journal articles, health facility reports, community meeting, targeted media, and campaign. Now it's time for recent updates. This is article published in 2024, Advancing in Medical Research Through Artificial Intelligence, Progressive and Transformative Strategies, a literature review. Artificial intelligence has become integral to medical research, impacting various aspects such as data analysis, writing assistance, and publishing. This paper explores the multifaceted influence of AI on the process of writing medical research paper encompassing data analysis, ethical consideration, writing assistance, and publishing efficiency. The review was conducted following PRISMA guidelines. A comprehensive site was formed in Scopus, PubMed, Embrace, and Medline database for research publication on artificial intelligence in medical research, published up to October 2023. AI facilitates the writing process by generating draft, offering grammar and style suggestion, and enhancing manuscript quality through advanced medical models like ChatGPT. Ethical concern regarding content ownership and potential biases in AI-generated content underscores the need for collaborative effort among researchers, publishers, and AI creators to establish ethical standards. Moreover, AI significantly influenced data analysis in healthcare, optimizing outcome and patient care, particularly in fields such as obstetrics and gynecology and pharmaceutical research. The application of AI publishing, ranging from peer review of manuscript quality control and journal matching, underscore its potential to streamline and enhance the entire research and publication process. Overall, while AI presents substantial benefits, ongoing research and ethical guidelines are essential for its responsible integration into the evolving landscape of medical research and publishing. Conclusion include the integration of AI in medical research has revolutionized efficiency and innovation, impacting data analysis, writing assistant, publishing, and others. While AI tools are significant benefits, ethical considerations such as biases and content ownership must be addressed. Ongoing research and collaborative effort are crucial to ensure responsible and transparent AI implementation in dynamic landscape of medical research and publishing. This is another article published also in 2024, Bridging Research Gap, How to Write a Focused and Critical Literature Review. This paper presents a comprehensive guide to conducting a literature review, particularly in the field of science, research, and academia. The literature review is a fundamental component of an academic work, serving to synthesize existing knowledge, critique methodologies, and potentially generate new insight through conceptualization. This paper discussed the two primary types of literature reviews, those covering mature topic requiring a critic of expanding knowledge, and those focus on the emerging topic needing a conceptual framework. Further, the proper paper outline the importance of this task for students and researchers and provide practical steps for effectively navigating the challenges of literature review, including source selection, summarize the synthesis and evaluation. Drawing on published research and extensive experience, this guide provides actionable advice and strategies for efficiently carrying out literature review regardless of topic's maturity. Now it's time for MCQs. First MCQ. Dr. Ahmed, a public health researcher, wants to study childhood malnutrition in urban areas. Before finalizing his topic, he wondered whether it will contribute significantly to local health issue. Which criterion should be assessed first? First is ethical consideration, B is feasibility, C is relevance, D is cost effective, and E is novelty.
B.
Novelty.
C.
Novelty.
It's C, relevance.
Relevance.
The study on database in rural Pakistan identifies underdiagnosed diabetic patient. The researcher debates whether they should provide medical assistance to these participants. Which ethical principle should guide their decision? Autonomy, informed consent, scientific validity, data confidentiality, and beneficence.
D. Informed consent.
D. E.
It's E, beneficence. A postgraduate student wants to conduct a study on rare genetic disorder but lack access to a specialized lab. They also need advanced equipment that is unavailable in their institution. Which research criterion is being compromised? Relevance, feasibility, ethical concern, novelty, and data validity.
B. Feasibility.
B.
Yes, B, feasibility.
B.
A medical
Feasibility.
student is interested in studying hypertension but is unsure how to structure their research question. Their supervisor advised them to ensure it is clear, measurable, and focused. What principles should they follow? Final criteria, Boycott framework, SMART criteria, Bradford Hill criteria, and STOP guidelines.
A.
Smart
A. Final.
criteria.
C. C.
Yes, let's see small criteria. Dr. Kamran is studying the effect of air pollution on asthma severity in children. He needs to clearly define air pollution and asthma severity in measurable terms. What should he use? Literature review, research objectives, ethical consideration, operational definition, and theoretical framework.
A.
Operational definitions.
D.
D.
Operational definition.
Operational
Definitions. Operational
Operational
D,
definition.
operational definition.
D.
Our researchers plan to conduct interviews with psychiatric patients about their past traumatic experience. Before proceeding, what is the most important first step? Being recruitment of participants, obtain ethical approval from the institution review board, start publishing preliminary finding, skip ethical approval since it's observational research, ensure financial support for the study.
B. Ethical approval.
Ethical approval.
B. Ethical approval. Ethical approval.
Obtain ethical approval. While drafting a research paper, a student is unsure where to summarize key findings without introducing new data. Which section should they write? Introduction, method, discussion, conclusion, and literature review.
Literature review.
Introduction.
Introduction.
A. E. Literature review.
As they summarize key findings only in conclusion. A study on diabetes management suggests that future research should explore lifestyle intervention. Where should this recommendation be included? In result, B is method, C is introduction, D is discussion, E is ethical statement.
Discussion.
Result.
Discussion. Discussion.
Yes, it's D, discussion.
D.
A postgraduate student noticed a sudden rise in antibiotic resistance case at their hospital. They decide to explore this issue through research, but struggle to define it clearly. Which approach will best help them define their research problem? Consulting expert, conducting data analysis first, ignoring existing studies, avoiding literature review, using non-peer-reviewed sources.
A.
Consulting experts.
Consulting
Yes,
consultant.
consulting expert. Dr. Hamid wants to study the link between air pollution and asthma, but finds several similar studies. His mentor asked him to ensure his research provide a new perspective. What should be focused on? Reviewing old studies, ignore previous research, identifying a unique research angle, using outdated method, changing the topic completely.
Unique method. Unique method.
Yes, it's identifying a unique method, research angle.
Yeah.
This is key of our MCQs. This is reference for from where presentation is made. This is our YouTube channel. Link for our YouTube channel. Thank you.
Assalamu alaikum. Thank you so much, Dr. Amir, Dr. Hussain, for a very nice presentation. And this is so good that you have presented very important concepts along with the MCQs. And everyone, I have heard that most of the people, they are very much interested in knowing more about research. I have also seen the WhatsApp group where many people have given a very good comments, and they are encouraged to learn research, because research is some of a very important skill, and nobody can learn research without doing it. So if you want to learn more, you have to be inquisitive, you have to ask questions, you have to give your comments and feedback, as well as you have to do the research yourself. Without it, just by listening to the presentations and reading the books, you can't become a researcher. Another important point that I want to highlight is that in a chat box, you can also write the important things that you should want to learn more. For example, in the chat box, I have seen that most of the people, they have given good comments, like Zainab has written an amazing and informative presentation. Thank you very much, Zainab. But I want all the students to write their feedback along with the question and queries if they are not clear about anything that has been presented. As far as the objectives have been presented, we have discussed in our Saturday Journal Club that it should be specific, measurable, achievable, reproducible, and time-bound. Today, we have also discussed it in detail. So I'm sure that most of the people are now very clear how the objectives are formed and how they are made specific. If you have made a good objective, then your whole research would be based on solid grounds. But if you are not able to design good objective, then your whole research would be faulty, and it would not be based on good foundations and good base. So always try to be very sure about how you are making the objectives according to the criteria. The second important point is about the measurements or the operational definitions. Again, a very important thing, and everyone should make it sure to go through the literature search again and again, and do all the literature search according to the criteria that has been laid down, and then do your operational definitions with references. If you are not giving the references, then your operational definitions are not acceptable. So in order to increase the validity of your research, both external validity as well as internal validity, and to increase the reliability of your research, you should go through the literature again and again. Then comes the tools. We will discuss the development of the questionnaire data collection tools in our coming sessions. So thank you very much for your patient listening.